Sounds like Starmer's Labour Party is quite serious about trying to create a country where everyone has a chance to grow old in good health. I think we should all welcome that. The big question is, can they do it? The last time we had a Labour government, they did transform the NHS. But the challenge this time, it's harder. The starting point is worse. And where they're trying to get to is a higher peak, is a harder climb. Not only are they saying we're going to bring down waiting times across the health service, they're saying, actually, we're going to improve survival rates and we're going to increase life expectancy. That's a really tall order. It's going to need investment, but I don't think anyone thinks we're going to see the same kind of investment that we saw under New Labour, that 6% a year. So that means the Labour Party, if it does form a government, will have to go much further, much faster on finding the right reforms, both within the health service and outside of it, if they're going to deliver on those missions.
Where does the money need to be invested? Because, of course, everybody would put their hands up to say, yeah, we want a better NHS, of course we do. But, you know, it literally is a pot of money, and whatever money you put into it, you always need more.
Well, we need smarter use of our money, right? We do need these reforms, and there's no point rewiring the circuit if you're not going to put new batteries in. And while funding is a pretty critical determinant of how good our public services are, but it isn't the only one. So what Labour are saying is that what we need to do is try and shift how we spend our money within the health system. So we're not just waiting for illness, but we're creating health. That means putting more money into primary care and into community care so we can try and stop people becoming very unwell. I think that's the right idea. Whether we see that happen or not is a big question, but prevention really is a really important step to try and bend that cost curve down. Healthcare costs will go up, but how quickly they go up, that's within our control, and that depends on the policy choices we make.
I remember my GP telling me more than a decade ago that social care was the ticking time bomb that was going to do for the NHS.
Yeah, social care and the NHS are interdependent. Now, it's important to see social care in its own right. It's a public service that is very valuable, one that we have ignored and ignored and ignored. We've seen politicians of all stripes overpromise and underdeliver on social care, and it should be respected in its own right. But it does have a knock-on consequence in the NHS. Let's think about hospital beds, and the reason we find it so hard to create more hospital beds is because of the pressures in social care. So I certainly would advocate for more money going into social care. I would increase access to social care so people aren't paying lots of money out of their pocket, having to sell their homes to fund their own social care. But I'd also completely transform the workforce. It shouldn't be the case that in a country like Britain, people are leaving the social care sector because they can get paid more stacking shelves in a supermarket. That is not okay. We need to realign the reward of being a care worker to the amount of the contribution these people make to our society.
Would junior doctors strike under a Labour government?
Well, we don't know. We haven't got a Labour government. We don't know where the junior doctors' pay rise will go. It will depend very much on what any next government does with the NHS. Does it become a better place to work? And what is key to that, sure, some of that is about better rewarding junior doctors, but it's about passing more power to the front line. People want to have a bigger voice in their workplace. We're seeing Wes Streeting yesterday talking about, actually, let's give patients choice. I think that's right, but patients and people that work in this office, they don't just want choice, they want voice. That's where we need to see a transformation.
It's always great to see you, Doctor. Thanks very much indeed.